Hi student, in this video you are going to learn how to draw the heart anatomy, and by learning the step-by-step of drawing, you will be able to draw the heart anatomy with understanding rather than just for the sake of drawing of the anatomy. For the first step, you have to know that whenever you have to draw a heart diagram, it is drawn for someone that as if he or she is standing facing you in front of you. So the right side of the picture is actually your left side, and the left side is the right side of your right side. Okay, so as you can see from here, from picture one, you can see the sides are reversed from your own side, and then from diagram number two you can see that this is the diagram that I took from the internet. You can see very clearly that the right side and the left side follows the first diagram that you can see on your left. You can also see the parts of the anatomy. On the right side, it says right pulmonary arteries, right pulmonary veins, right atrium. And on the left side, you also can see the left pulmonary arteries, left pulmonary veins, and left ventricle. So remember, whenever you draw the heart anatomy, you have to know that the right side and the left side of the picture are reversed from your own left and right side. Step number two is to understand the blue and the red color of the diagram that you see on this slide. So you have to know that the right side is with the blue color, which means that it contains the deoxygenated blood, or the blood that has low oxygen but high in carbon dioxide, because it has been used by the whole body to absorb the oxygen and give the carbon dioxide to the blood. While on the left side you can see the red color. It means that it contains the oxygenated blood, which means it is high in oxygen and low in carbon dioxide. So you can see that left side from this diagram is the pathway for oxygenated blood, and the color is red. Step number three is about the departure and arrival chambers. So I have attached this diagram on this slide, and you can see I have made the lines of the chambers, or chamber is actually room. So there are four rooms in the heart, you can see from this diagram. So I have used the black ink to help you to see the four chambers more clearly. Now, for the first one, I start with the systemic circuit. You can see here that the first arrow comes out from the fourth chamber, which is at the bottom on the left side of the diagram, and then go to number one. You can see from the diagram, which means that it's moving toward the body. And then in the body, of course, you have learned there are capillaries where the oxygen are exchanged with the carbon dioxide, and the nutrients will be absorbed by the tissue in our body. And then the deoxygenated blood, or the blood that is low in oxygen, will go back to the heart. So I have used this green arrow for the departure point, or the chamber for the departure of the blood. I put a dot, green dots, okay? And then for the arrival chamber, I use the arrow, okay? So you can see that it starts from this chamber with a dot and go to number 1, 2, and 3 and go back to the heart. And you can see the arrival point, or the arrival chamber of the blood in the systemic circuit. The other circuit, which is called pulmonary circuit, you can see from the picture that the first arrow comes from the chamber on the bottom side on the right, okay, and then it goes to number 4 goes to number 5, which is the lungs, and the blood will get the oxygen. Now they become red because they are now oxygenated, and goes to number 6 and go back to the heart. Okay, so you can see that's the pulmonary circuit. If I use the same symbol, which is the departure point for this pulmonary circuit, in the form of a green dot, and the arrival is informed in a green arrow, you can see the second pulmonary circuit pathway. It starts with the lower chamber on the right side of the heart and go back to the heart and the upper chamber on the left side. So far, did you notice that the departure chambers are always the lower chambers of the heart, both on the right and the left side? And the arrival chambers, or where the blood comes into the heart, are always the upper chambers of the heart. So the next step that you need to learn is actually the name of those chambers. So the upper chambers are called the atriums, and the lower chambers are called the ventricles. And furthermore, did you also notice that the blood that arrives in the atrium should go down to the ventricle, which is the lower chamber, to start the other circuit? So you can see the purple arrows that I drew in on this slide. Okay, you can see between the arrow and the green arrow and the green dots, you can see two purple arrows. So these arrows are the symbol that actually the atrium, the upper chambers, and the lower chambers, the ventricles, they are both connected, and they are connected through a unidirectional valve, or it means that the valve only moves to one direction. It's called the atrioventricular valve. So you can see from the picture that the valve can only be open to one direction, which is to towards the ventricle. So the blood will move from the upper part of the heart, goes to the lower part, okay, through the atrioventricular valve. So I think by looking at to this GIF picture, you can see the green arrows that I drew on the slide. So that this animation shows you how the unidirectional valves of atrioventricular valves can only be open to one direction, which is from atrium to ventricle, but not the other way around. Okay, so far you have learned about these four chambers and the names of those chambers. So on the right side, you can see the right atrium and the right ventricle, and between the right atrium and the right ventricle, you can see the atrioventricular valve that creates a passage or the pathway for the blood to comes from the atrium to the ventricle. And on the left side, you can also see the left atrium and the left ventricle, and in between those two chambers, you can see the atrioventricular valve. So yeah, that's the basic. By the way, the basic. Now, are you ready for more details? Well, ready or not, I'll continue with my explanation anyway. So in this step 4A, the right atrium received blood from the upper and lower body parts. So you can see from the first diagram on the left side, you can see that the now I'm sure you know where is the right atrium, right? So you can see the arrow, the red arrow that I put on the slide. You can see this right atrium receive the blood from the whole body from two different pipes, okay, or two veins. So the one at the bottom and the one at the top. You can see the arrow, right? So on the other diagram, this diagram zoom in the two pipes or the two blood vessels. They are basically veins, but because they are the major or the largest veins, now their names are modified a little bit to become the vena cava. All right, there are two vena cava. The first one is the superior, which means that the vena cava that comes from the upper part of your body, your head, your shoulder, and the other one is the inferior vena cava. You can see the other arrow at the bottom. It means that this blood comes back from the whole body that located in the lower part of your body, which consists of your abdomen, your legs, and so on. Basically below your heart. All right. So again, now you learn that the right atrium receives blood from two different veins. The first one is the superior vena cava, and the other one is the inferior vena cava. How about the left atrium? Now you can see from the first diagram, the left atrium, it has also the vein that comes back or send back the blood back to the heart. You can see the right pulmonary veins and the left pulmonary veins. This time the name is not vena cava because basically they are not the largest, right? You can see the relative size of the pulmonary veins compared to vena cava. Of course, the pulmonary veins are much smaller than the vena cava. Now, on the second diagram on your right side, you can see that the atrium, you can see the green circle. The atrium has four different holes that come from the four different pulmonary veins. Why there are two directions from the pulmonary veins on the left and the right? The explanation is pretty easy because you have two lobes of lungs. There are lobes of lungs in the right side and the other one on the right on the left side. So that's why there are two directions for the pulmonary veins to come back to your atrium. One, like a pair, comes from the right side and the other one comes from the left side. Now, for your information, most of the time, not most, like sometimes, the veins or the pulmonary veins from the right lungs are omitted, which means that they are not included in the diagram. Why? Because they are hidden at the back, so you cannot see them clearly. So it's okay for the IB even just to see the two pulmonary veins from the left side. Okay, so you can omit the other two or the other pair from the right side of the lungs. So in this diagram, you can see what you have learned just now and what you have learned in the previous slides. You can see that the red arrows for the superior vena cava and the inferior vena cava that brings the blood to the right atrium, and you have learned the right atrium in the previous slide. And there are also pulmonary veins. Can you see the red arrow on your left on your right side? Yes, those two are also new. You just learned about this. So yeah, basically these are the things that you have learned so far with the names and also the structure. Remember, for the pulmonary veins, you can draw only one pair from the left side of the lungs or the lungs and left lobes. And the next step, which is step 5A. Now, not only the atrium that has the blood vessels connected to it, but also the ventricle. So you can see the two ventricles have blood vessels that are connected to them. Okay, here I put the name pulmonary artery and aorta. Okay, can you see the two red arrows? So those two blood vessels are basically the blood vessels that let the blood leave the ventricle, or the ventricle as the departure points, through the arteries. The one that goes to the lungs is called pulmonary artery. And the one that goes to the whole body is called the aorta, or the largest or main artery. And for step number 5B, inside both pulmonary artery and aorta, you can see the yellow arrow that I put on this diagram. Okay, now you can see that the blood has to flow up, going up, right, against the gravity. So to avoid backflow, that's why you can also see in the red arrow called semilunar valves. So both valves, again, like the atrioventricular valve, it can only move to one direction, which is going up, but that will not let the blood to move back to the ventricle. So only one direction. Okay, and it's called the semilunar valves. And step 6, which is the last one, the last but not least, the cardiac muscle. Right. So since the left ventricle has to pump the blood to the whole body, so it is more muscular compared to the right ventricle. Right. So you can see the yellow arrow that I put on the diagram. You can see that the wall of the cardiac muscles of the right side, or the right ventricle, is way thinner compared to the left side, or the left ventricle, right? So it means that the muscle on the left side, on the ventricle, okay, left ventricle is way thicker compared to the right ventricle, because the left ventricle has to pump the blood to the whole body, so it works harder compared to the right side, so it is more muscular. So here it comes to the summary of the steps. Step 1. First, you have to know the right side and the left side. So I put the R and the L in blue. And I start with the small little curve over there. And the curve represents the wall of the right atrium. And the second step, I put the two blood vessels in red. Those are the representative for the superior vena cava and the inferior vena cava. And in step 3, I also draw the red lines. These are the representative of the atrioventricular valve that connect the atrium to the ventricle. And this is step 4. I draw the red line, step 4. That's the representative of the ventricle of the right side. And then in step 5, I draw another red line. That's to make the uh, artery pulmonary to become intact, to become like a blood vessel. And in step 6, I put another red lines. Those two represent the semilunar valve, right, for the pulmonary artery. And then in step 7, I put a small curve with red. It is the representative for the atrium wall on the left side. And then I create on step 8 the two blood vessels. Those are the pulmonary veins. And remember, you don't have to draw the pulmonary veins from the right side, so only the left, that's okay. And then go to number 9. I draw the atrioventricular valve for the left side. And then in step 10, I drew the line with the red, the line for the left ventricle. And then in step 11, I make another line to make the blood vessel or the aorta complete, including the semilunar valve for the aorta. So here comes the last part of the drawing, then the step number 12, which is my favorite because this is the ending. Okay, so you can add this red line that represent the thickness of the muscle in both the right side and the left side of the ventricle. So you can see that the right ventricle tend to have thinner wall compared to the left ventricle, and you know why, because left ventricle has to pump the blood to the whole body. Now the other diagram on this slide on your right, you can see I circle the branches of pulmonary artery and also the aorta, because those are optional. So if you want to draw both aorta and pulmonary artery as straight blood vessel without the branches, it is actually fine, and the IB accept that. So yeah, the last final step. If the question asks you to label, it means that you have to label the structure. So you can see, you can pause this video for a while. Yep. And remember, if you draw a structure, you have to use 2B pencil. Why I do not recommend you to use a pen? Because if you make mistakes during the IB exam, you are not allowed to use correction pen. So it's better for you to use a pencil. So if you, in case you make mistake, you can erase the part that is incorrect, and then you draw it again. Right? Pause the video for a while so that you can also label your diagram on your notes. Alright, that's the end of this video. I hope you now know how to draw the heart anatomy with understanding. So it's not just to memorize lines and curves in the structure, but you really draw the anatomy of the heart with an understanding. It will help you to draw the structure correctly. And don't forget to practice, keep on practice, because drawing to be able to draw the structure correctly, you need to repeat the process a couple of times until you can really master the drawing. Okay, and in the next video, you will be watching the contractions and relaxations of the heart muscles, okay, or what we call the cardiac cycle. All right, thank you so much for your time. I hope you learned something useful, okay, for your IB biology course. Bye.